At Get Real Health, we are 100% focused on patient engagement. Our goal is to allow patients to not only store their wellness and chronic disease information together, but to then be able to choose who, when, and where they want to share that, whether it be with their providers or family caregivers. We have two products, empowerment tools, if you will, to help patients and providers collaborate to improve healthcare. The first is Instant PHR, which is our patient-facing engagement platform, which is really now deployed worldwide. And the second is CHBase, which is our data aggregation and application development platform designed to maximize the value of data. Our development platform allows for easy integration with devices, apps, and all of the other fun tools that are being developed on the market now. This is where we can bring all of the patient and provider data together, whether it comes from an EMR, a laboratory system, a patient portal, or even all the fun apps and devices that people are already using. Within CHBase, we have data transformation for analytics, data cleaning and shredding, and data exchange services. So before we go any further, I'm going to act as the patient for a moment. I want to point out two things. One is a Fitbit that I'm wearing, and the other is this eye health pulse oximeter that measures a patient's oxygen levels. This is important to note because we're going to see this information sourced into the product shortly. I want to demonstrate the flow of data from the device here to Jose's patient portal and then onto the provider EMR through the use of CHBase. Within CHBase, patients can decide who they want to share their record with. They can also choose which data points they want to share. That way, they are always in control of their health information. Patients can also connect with any of the apps or devices that help manage their care. Here on the Apps Directory page, all a patient has to do is make a one-time connection from their account in Fitbit or in iHealth, and then the data flows. So let's take a moment to see this data displayed in Instant PHR after it has passed from the device through CHBase. The settings of the device's app control the speed at which the data flows, but this pulse ox and the Fitbit travels in near real time. This is also true for the information to flow into the provider's EMR. If we look here in the patient's record within the patient portal, we see that the data from the pulse ox is here. Let's take a look at the reading from yesterday, which was 99% at noon. Not only do we display this data, but all of it is tagged and sourced so that clinicians know that it's trusted data. We're going to go ahead and look at the same exact data within my EMR. Again, you'll notice the 99% reading at noon yesterday. Not only can I view the patient-generated data here within my EMR, but I can also set up alerts around the data so that if I have a patient that's in trouble, I can receive an alert to let me know. Another great use case for this to be used in is with congestive heart failure. For the congestive heart failure patient, all they would need to do is get on a scale, and what we're able to do is then set alerts around those measurements that come in. So myself as a provider could get an alert if somebody's weight went up. Now, of course, I chose not to use a weight scale in a live demonstration today because I didn't want to get on a scale in front of all of you. I recognize that my patients live their lives outside of my care, and it makes me feel more comfortable knowing that not only can my patients participate in the management of their care, but I can feel comfortable with them caring for themselves at home, knowing that I'm going to get alerted if they require more urgent care. This flow of data ensures that we keep people living their lives, yet still effectively managing their care in a more cost-effective way. Thank you.